Hello everyone, this is Beth Grigg, the Director of Windermere Residential Health Services. This is going to be a mini presentation to help educate about strokes, the symptoms that you might notice, and when you should call emergency services. If you experience one or more of the following symptoms, call 911 immediately. FAST is an easy way to remember the sudden signs of stroke. When you can spot the signs, you'll know that you should call 911 for help right away. FAST stands for the following. F stands for face drooping. Does one side of the face droop or is it numb? Ask the person to smile. Is the person's smile uneven? A stands for arm weakness. Ask the person to raise both arms. Does one arm drift downward? Is one arm weak or numb? S stands for speech difficulty. Is speech slurred? Is the person unable to speak or hard to understand? Ask the person to repeat a simple sentence like, "The sky is blue." Is the sentence repeated correctly? T stands for time to call 911. If someone shows any of these symptoms, even if the symptoms go away, go ahead and call 911 to get the person to the hospital immediately. It's important to check the time when you first notice the symptoms because the medical team will need that information as part of their treatment plan. Beyond FAST, there are some other symptoms that you should know. These are symptoms that you should also get emergency help for. Sudden weakness or numbness of the face, arm, or leg, especially on one side of the body. Sudden confusion, trouble speaking or understanding speech. Sudden trouble seeing in one or both eyes. Sudden trouble walking, dizziness, loss of balance, or coordination. Sudden severe headache with no known cause. If someone shows any of these symptoms, immediately call 911 or emergency medical services. Even if you're not sure, go ahead and call so you can be checked out. Minutes matter. Fast action can save lives. It is important to realize that stroke warning symptoms are the signs of an emergency. For every minute the brain cells are deprived of oxygen during a stroke, 1.9 billion brain cells die. Also, the chances for survival and recovery are much better when the right treatment begins within the first few hours of noticing stroke symptoms. Remember to note the times that the symptoms began or the last time the person was seen acting normally. When in doubt, call them out. Go ahead, call 911, get the paramedic team out right away so the person can get into the hospital for their emergency treatment. While you are waiting for an emergency vehicle to arrive, the person with the stroke symptoms should lie down. Watch the person suspected of having a stroke and lift the chin to open the airway if needed. Check for breathing and pulse. If necessary, perform CPR. If the person is breathing but unconscious, roll him or her onto his or her side. However, do not move the person if they have fallen or if you suspect a head, neck, or back injury. If the person is conscious, try to reassure and comfort him or her. Loosen constricting clothing or jewelry. If the person is having difficulty swallowing, try to turn him or her onto the side. Do not give the person anything to eat or drink. Thank you to the American Heart Association for providing this important information. If you would like further information, you can visit their website at heart.org, or you can stop down to Residential Health Services at Windermere. We're always happy to give you more information. Thank you for attending this important presentation.